It's time to put your health in your own hands. Get ready to learn from today's top health and wellness innovators and thought leaders on Optimal Health Radio. Now, here's your host.
Hi, this is Tammy Patzer, and I'm really excited to introduce today's guest, Dr. KEESHA Ewers. KEESHA, or Dr. KEESHA, as we love to call her, is a doctor of sexology, a psychotherapist, and is board certified in functional medicine and holds an advanced certification in Ayurvedic medicine, and is the founder and medical director of the Academy for Integrative Medicine Health Coach Certification Program. Dr. KEESHA has been in the medical field for more than 30 years. After being diagnosed with rheumatoid arthritis, an incurable disease according to Western medicine, she discovered how to reverse autoimmunity using her Freedom Framework method, which she has now used with thousands of her own patients and teaches to her health coach students in her online certification program. Dr. KEESHA is a popular speaker, including at Harvard and from the TEDx stage, and the best-selling author of Solving the Autoimmune Puzzle, The Woman's Guide to Reclaiming Emotional Freedom and Vibrant Health, and Your Libido Story, a workbook for women who want to find, fix, and free their sexual desire. You can listen to her on Healthy You radio show and find her programs at drkeesha.com. Welcome, Dr. KEESHA.
Thank you so much. I'm so delighted to be here.
Oh, wow. Your background is so phenomenal. And I have just so many questions. But first of all, tell me more about who you help.
So in your intro, I just want to clarify, you said autoimmune, and it might make people think has to do with hearing, but it's actually autoimmune. So the people that I help, no, that's okay, are people, women in particular, but men and women, who have an autoimmune disease or who have a lot of inflammation, who don't even know they might have an autoimmune disease. I diagnose autoimmunity in probably 80% of my new patients who don't know they have it. They just know they feel frazzled and fried and completely fatigued, and they're overweight, so they feel fat. And when we get right down to the root cause, it turns out that they've got their own immune systems attacking them. And, when we get down to the root cause of that, then oftentimes there's a history of past childhood trauma. So I really focus in on helping women who have been traumatized, whether it's what we would call capital T trauma, which is sexual abuse or domestic violence or psychological or verbal abuse, but also the chronic day in and day out stress that causes the same changes in the brain as big capital T stress.
That's really interesting. So, for example, if you were a child who maybe had a parent who was absent a lot or had an illness themselves, so that you weren't being taken care of in a way that a child might need to be taken care of, or you were in a situation where you had to act more like an adult, that might fall under those stressors.
That's exactly right. The Adverse Childhood Experiences Study, which was conducted between 1995 and 1997 by the Centers for Disease Control and Kaiser Permanente, found that people said that over 17,000 people that took the survey in that study had at least one ACE score, which means an Adverse Childhood Experience score, such as what you just said. Parents that got divorced, parents that were addicted to drugs or alcohol, parents that had an illness, or a sibling that had a special need, so that the child feels neglected and not seen, right? And so then a meaning is created by us as small children because our brains aren't even fully developed till we're 26 years old. So when we're little kids, we make stuff up about our experiences if there's not a real solid, grounded caregiver present in that moment to help us navigate these experiences. And, any of us that are parents know we can't be there 24/7 to do that for our kids. So every kid comes out of childhood with some belief that's self-limiting. And it's because we're self-centered when we're little children. That's our developmental state. We're supposed to figure out how we fit in this world, and it is about us. And sometimes we make up beliefs that aren't accurate, like I'm not important, or I'm not deserving, or I'm not safe, or I have to be perfect, or, I'm not good enough. There are a zillion of them. And these beliefs actually cause us to not take care of ourselves properly in adulthood. And a lot of women in particular will take care of others instead of themselves. And we wind up getting sick. And that's who I help reverse that whole dynamic, that whole pattern.
Oh my goodness. I'm listening and I'm thinking to myself, I mean, I can look at myself and know that I've spent my entire life taking care of other people. And until just recently, did I start to think about who am I? So I imagine that I'm probably not that unique, that there are probably thousands or hundreds of thousands or millions of people out there dealing with that. So how do you look at a person and, they might, come in and say, hey, doc, I just don't feel good. I'm overweight and everything. How do you start to this process of uncovering what you call the root cause?
Well, I have a framework that I call the freedom framework, and it's the freedom to break free of all this stuff. And the first step in the freedom framework, there are 4 steps to it. And the first one is to uncover the root cause. And what I do is I go through the 5 root cause areas as I'm interviewing my patient. So I'll go through how they tell their story. If they tell their story and they use words like, I have fought with my weight my whole life, or I feel trapped in my body, and, those kinds of words, they actually tell me something. So I listen to how the story is told, and then I look at the physical root causes by doing laboratory data. I do a lot. I always say, test, don't guess. So I do the kind of testing that insurance doesn't normally pay for because, women go in and get their thyroid checked, and if their doctor is only checking a thyroid stimulating hormone, TSH number, that doesn't tell us really anything about the thyroid. So I do a lot of in-depth testing for the physical. And then I'm looking at the mental, emotional, and even spiritual root causes. Is there an existential angst going on? In other words, every human asks that question at some point that you just did, Tammy. Who am I? Who am I if I'm not a mom, a wife, a daughter, a sister, a professional of whatever I do? A Christian, a Muslim, a Jew. I mean, you name the labels we put on ourselves and the hats we wear. Who are we underneath all that? And if we haven't figured out how to find our place in this universe and how we work with each other in a harmonious way, we get sick. These things actually cause the physical body to get sick. And so I'm looking at all 5 of those areas for root causes, and it's fascinating how they all work together.
So how long is this process? Obviously, it's a lifetime to develop these issues, and by the time they get to you, their body and their brain and the whole person is going, something's got to give, something's got to change. So once you start this process, how long does it take to help somebody to at least start the healing process?
It really depends, but usually within about a month, people have lost weight. They're starting to feel their energy shift. They're starting to see that their hot flashes are going away. They're starting to see that their memory's coming back online and their brain's clearing up. They're starting to see their rash go away on their skin. And there's the needle is moving in the right direction on the compass for, in other words, in about a month. I usually tell people, though, you really have to be prepared to put your seatbelt on and be really patient with the ride. Because when I was 30, I was diagnosed with rheumatoid arthritis. This is how come I know all this stuff. I've been there, done it, have the t-shirt. And when I was diagnosed with rheumatoid arthritis at the age of 30, my body had been telling me for a good 20 years that it was imbalanced, but we're not taught to listen to the body's feedback. So, for example, I had multiple urinary tract infections as a child, multiple bouts of strep throat treated with antibiotics as a teenager, terrible acne that I actually took antibiotics and Accutane for. And, just on and on like this. And then I had eczema. And these are all, and terrible PMS, and bloating after every time I ate, and constipation. And these are all feedback mechanisms from the body saying, hey, things aren't going well here. We're not getting along together as a team. And then I started struggling with my weight, and then one day, my family was getting ready to go to Disney World, and I had everybody packed, and we were waking up the next morning, we were taking off, and I woke up, and my joints were huge, swollen and red, and I was annihilated with energy. I'd always been called an energizer bunny. I was an overachiever, go-getter. I ran marathons, and I'm going to say this in air quotes, all of a sudden, I couldn't get out of bed. Well, that's what it feels like to me all of a sudden, because all of a sudden I'm not the energizer bunny anymore. But in reality, it was 20 years in the buildup. It wasn't all of a sudden. It never is. And so when I learned all of this, then I started understanding how to be in collaboration with my body, and I was able to reverse my autoimmune disease within about 6 months. But, that's how you kind of have to think about it is, okay, you've been at this for a long time, so don't expect miracles in 1 month, right? Or 1 week. And there's no such thing as a magic pill. So I usually tell people, give it about a year to really, really reverse whatever it is going on, depending on how long you've had it.
Wow. I'm just sitting here thinking about that. So you were 30 years old, the Energizer Bunny, and it appeared to come on overnight, because that moment in time was that you woke up and your joints were all inflamed, but obviously your body had been talking to you for, like you said, for 20 years since you were a young person. And
right.
Were you already in a medical professional at age 30?
I was.
So
I did high intensity, intensive care, oh my gosh. I thrived on the adrenaline junkie form of medicine. And in the Western, I call it standard American medicine, in that model of medicine, what you get is a prescription if you have rheumatoid arthritis for a cancer-fighting drug called methotrexate. We're still doing that still. And non-steroidal anti-inflammatory drugs, and told to go home and take these and come back if you get worse, because then we have to put you on an immune modulator. And I asked my doctor when I was diagnosed, can I do anything with my diet? Does this have anything to do with my lifestyle? And she said, no. Do you have any autoimmunity in your family? And I said, well, I think my grandfather had rheumatoid arthritis. I mean, he died before I was born. He died at 59, and I remember my aunt talking about him being in a wheelchair for a period of time in his adult life. And, sure enough, he did have autoimmune disease. And so she shrugged her shoulder, and she said, well, you just drew the short straw in the genetic lottery. And so, it's typed off as it's genetic. You can't do anything about it. Take these drugs that actually have worse side effects than what you're going through now and are going to make you even sicker. And nothing about how, in Ayurvedic medicine, I learned about Ayurveda in my research after I went home, which is the sister science of yoga. It's 10,000-year-old framework of medicine. And they said 10,000 years ago that rheumatoid arthritis is actually undigested anger. I had to sit and think about that because I was a really nice person. I was a people pleaser. I wasn't angry. I couldn't even imagine what I was angry about. So I sat down and I started meditating on this word autoimmune, which means I'm attacking me. And I got that right in that moment. I'm committing suicide. Why am I killing myself? And so I started going back, looking for where I started being angry or wanting to die, trying to figure out this puzzle. And I came upon my 10-year-old little girl self who had been sexually abused in elementary school by the vice principal. Now, those two things we now know through science are very connected. And I thought I had dealt with it, but clearly my body had all this anger still inside of it. And I certainly had not done a complete job of it. And so that's really, Tammy, where I went. I did change my diet. I took myself off of sugar. I found out I was allergic to gluten and dairy. And then I dealt with this anger that I'd never expressed. It had just gone into my body and it was eating me alive, literally.
Wow, I can really see that. And now I understand what you were talking about with those type T traumas. And it's interesting that I mispronounced it because I was going, how did I do that? Because I know what autoimmune means, and but it's interesting as you look back, and I wonder how many people there are, like you said, it can be the trauma, like what you just described, the vice principal abusing you when you were only 10 years old. And you obviously, as a little girl, because like you said, your brain isn't even developed until, what did you say, 26 or 27 years old? And a little girl wouldn't have the capacity to even really deal with that in any way other than a little girl way. And so your body goes into whatever, I guess, protective mode or something. And then you forget, but yet it's still there, undigested anger. And I wonder how many people have, those issues. And as, your body said, hey, at age 30, but then there's other people, 40, 50, 60, 70 and up. I know that I had a huge gallstones. And again, I haven't studied, all I knew is that obviously my body created these blocks, that created pain. And so that's very interesting how our bodies deal with different stresses by creating those different things. And like you said, in Western medicine, the answer is either in a pill form or an operation type form. You don't need it. We'll just get rid of it. We'll remove it. And a lot of doctors, like you said, the doctor said, oh, it's probably genetic. How many people have been told that whatever it is they have is genetic? That there is nothing they can do about it. So then they deal with it in the traditional way. I always wonder about people with cancer who are treated with chemotherapy. And everyone I've ever talked to who's gone through it, they say, well, yeah, they basically nearly kill you in order to save your life. And I'm thinking, whoa, the quality of your life must really suck, when you're going through those treatments and everything.
Oh, absolutely. And as you say, the implication when you see that it's in your genetic lineage, oh, my dad had diabetes, or my mom had heart disease, or my mom had Hashimoto's autoimmune thyroiditis too. My whole family has it. Or we're all fat, we're all obese. the implication is that means because it's in your genetic DNA that you can't do anything about it. And now we know that is absolutely patently untrue. And in the study of epigenetics, what we know is that we can control how we express our genes. And that's through a whole series of lifestyle things that we can alter. And I do a lot of genetic testing in my practice. Almost everybody that comes to me has been to doctor after doctor after doctor, and I'm sort of like the last last little oasis at the end of a long desert. And, when I do the genetic testing, I can say, look, this is why this is happening. This gene has a mutation in it that you got from this parent that, yes, has Alzheimer's. But guess what? You don't have to develop Alzheimer's, because here's what we know about this gene now. If you do this and this to your diet, if you take this supplement, if you do this with, other parts of your life, then you can actually turn that gene off, so to speak. So that's a really exciting thing. And I've never been so excited to be in medicine as now, because we do have these ways of being able to really get precise. I call it precision medicine. And, quite honestly, Tammy, so often what I'm seeing is it's actually proving out what the Ayurvedic, what we call the rishis or scholars 10,000 years ago had already figured out, which is so fascinating to me.
Yes, that is fascinating, because it's like, what happened?
We started relying on medications. That's what happened. We saved lives, like polio vaccination and early deaths through bacterial infections that got to be prevented with antibiotics. And then we went clear over the other end, and we stopped thinking about the digestive system as the root of health. We stopped thinking about food as medicine. In America, we say if a little bit's good, a lot must be better. So we did what we typically do. We went overboard. We went clear this direction and kind of threw the baby out with the bathwater. And, it doesn't work that way. So we totally ignored the laws of nature and started just saying there's one active ingredient in everything. And that's not, nature tells us that's not true. It's all about synergy. So it's a really fascinating thing that's happened, but people are starting to see, in Western science, a lot of us have picked up this hue and cry of we need to start integrating, the technology that we have of today, which we should never throw out, and integrate it with the wisdom that the earth teaches us, and a lot of really smart people throughout history have learned patterns, and we can integrate all of that. So a lot of people are starting to wake up to that now.
That's really interesting, because, well, here's a prime example. Until I met you, I had never even heard of the term functional medicine. So think about that. And I'm fairly educated, yet that I had not heard of that term functional medicine. And now I understand a lot more about, that everything isn't curable with the latest pill, that television advertising would make us think that, all we need is, the magic purple pill for this and this pill. And everybody always ignores all of those side effects that they say in the really fast voice on the TV commercial. And I'm like,
they always end with death. And death,
could cause death. And I'm going, why would anybody want to take that pill with all those side effects? Because it's just crazy how, we ignore, we'll focus on that one thing and ignore all the things like, hey, doc, if I change my diet or if I exercise more, could that help me? Here's a pill, and it's interesting. So I'm really glad to hear that there are a lot of medical professionals who are saying, hey, let's stop this craziness and let's get back to the reality of literally time-tested medicine where our we eat the right way, we exercise the right way. And now, like you said, we have all of these methods of testing our genetics, testing for different things so that we can know exactly what's going on with that, the science of the test, backing it up with the treatment. Because obviously, if you tell someone how to treat themselves and how to work with themselves emotionally, you can actually show it in that blood test or some test that it's working. So you actually are able to use the best of all worlds in that medical profession. So tell me, if somebody wants to work with you, how can they do it?
DrKeesha.com is my website, DrKeesha.com. They can pick up a copy of my book, Solving the Autoimmune Puzzle, that really goes very deeply into what we've only been able to kind of scratch the surface on. And for people that are really passionate and think the ship has sailed, for them to go to medical school and really help other people, I have a certification program where I train people to be integrative medicine health coaches to do what I do. And it's, I think, going to really save American healthcare to have this new strata of medical delivery called health coaches. And not all health coaches are alike. And so I started this amazing program. So it trains integrative medicine health coaches to do what I do, to do the same testing, to use the same freedom framework, and to really listen to people and put together their clues. I call it being a medical detective. And you can find out information on my website about that too, Dr. Keesha, or just work with me one-to-one. I love helping people really reverse these chronic illnesses. 80% of them are diagnosed in women.
80% are women. Wow. You also have a program called You Unbroken and another one called the Libido Cure for Women. What are those?
So these are online programs that I develop for people who they identify if they listen to a talk I give from stage or they hear a video that I do. Oh my gosh, I had trauma in my background and I need to know how to overcome it. The You Unbroken program is amazing. It is for that. It helps you to be able to reframe the beliefs from childhood that you had when you were stressed. And so that you can move forward in a more powerful way. I call it going from victim to vital. And then the libido cure, the same 5 root causes that are present for autoimmune disease are present if you have low libido as a woman. And I always, this is a whole nother interview, but I talk about libido as a gas gauge on the dashboard of your car. If it's low, it means you are out of gas. And instead of drinking caffeine or Red Bull or eating sugar, and then ignoring it, your body's trying to say, I need some attention, because libido is desire for your whole life, not just for sex. It's like, how am I with the things I love in my world? Am I passionate about them? Or is my gas tank empty? So that's a whole program for helping people really reclaim their desire for life and to understand what's going on with them if they have a sexual desire blockage.
Wow. And that's at DrKeesha.com?
Yes, both of those are.
Okay. Wow. That's all of everything. We will have to do another interview and focus on different topics in the future, because you're absolutely right. There's just so much that we can cover, and you have such a wealth of knowledge. So I really appreciate that. So Dr. Keesha, thank you so much for spending time with us today. And again, we'll come back another time and we'll talk about your online program, You Unbroken, and the Libido Cure for Women, because I think that we would have a lot of interest in that with our listeners. So I hope you will come back. So thank you.
Oh, I'd love to. And thanks so much for having me and giving me an opportunity to reach out to people that need to hear this. Thank you so much for the work you're up to in the world, Tammy.
I appreciate that. This is Tammy Patzer. Go make it a beautiful day.
You've been listening to today's top health and wellness innovators and thought leaders on Optimal Health Radio. To get more solid health and wellness information, visit OptimalHealthRadio.com.